When we see, I think ideally the age bifurcation is very much required. So peripheral symptoms first should be ruled out, and then I think we can go to the central symptoms.
Exactly.
Yeah. If we see the kidney functionality, so we found certain abnormalities in the creatinine levels of some employees. So is it suggestive of early kidney stress, or what could have been the problem?
That is something which is alarming. You see, the thing is that whenever you find the creatinine getting abnormal, check the patient's sugar and check the patient's blood pressure. High blood pressure patients over a period of time, the creatinine tends to go up. Diabetics over a period of time develop kidney problems and the creatinine tends to go up. So that's where you want to look at it.
And in terms of liver health, are these all correlated, or is any specific thing which we can do for liver health, or is it a positive factor for all the other ailments?
No, not exactly. That's the liver. I mean, that is something which Ayurveda and homeopathy believe so much in, apparently, that the liver is the center for all the illnesses. What we are finding is this fatty liver sort of a thing, which we initially used to ignore, is something which is really important now. And that's also because of the unhealthy lifestyle, is because of the unhealthy food habits. Primarily because of taking a lot of saturated fat, a lot of processed foods, you get a fatty liver. And initially we used to think that in the initial stages that you get cirrhosis of the liver because of hepatitis B infection. You get cirrhosis because of alcohol. You'll be shocked to know that today the largest cause of cirrhosis of the liver is the fatty liver. Largest cause. More than hepatitis B and hepatitis C, more than alcohol, it is a fatty liver because of poor dietary habits, we call it. And the deterioration which you get in a fatty liver is dramatic. I've seen my patients in 2 to 3 years looking healthy like you and me, and in 3 years getting cirrhosis and having to go for a transplant. In 3 years. In an alcoholic, for example, it would take 20-25 years of regular drinking before that will happen.
What exactly could be we are seeing?
It's a food. It's a food.
Okay.
Absolutely the food.
So when you see, as we see in the market, all types of foods are coming. Organic foods are coming, then processed foods are coming. You cannot identify the various parameters on how to get it. So is there any preventive thing, any preventive medication, or a small thing which we can do on daily basis, a home remedy or something where somebody can protect their liver? Because
there's no such utopian thing like one pill and it goes away. It's a holistic approach that you need to have, in the sense that you need to make sure that your diet is proper, you do your regular exercises. Of course, if you want to get rid of the fatty liver, there are lots of medication. Especially there are certain new molecules which have come, known as GLP-1 analog, which are excellent for reducing the fat in the liver.
Okay.
And in fact, it would even, to a certain extent, at stage 3 liver damage can be brought down. But once you're in stage 4, nothing can be done.
There is a a discussion going on as per the YouTube channels that drinking coffee is good for liver health, tea is detoxicating the liver. So what is your opinion about this?
I really don't believe so much in it. Coffee is supposed to be a good antioxidant. But remember, anything in excess is going to be a problem. Nothing in excess is going to be good for you. We need to get it under control. It takes a little about. And when you're talking about coffee, you're not talking about processed coffee. You're talking about raw coffee, in the sense where you brew your coffee, the actual brew. That is what is important. Not the soluble coffee which you get, I don't want to make name, but any instant coffee. Instant coffee is not coffee.
As we spoke regarding the women health and anemic conditions, postmenopausal syndromes and everything, nowadays breast cancers and everything are more prevalent, and they are being reported in the younger age groups as well. What could have been the positive factors in?
Right, there are two or three things here. One is that we are becoming more and more aware of the disease. Women are becoming more and more aware. I remember right at the beginning of my practice, I had a lady who somebody asked me to see. She has a lump in the breast and it was a fungal mass. When I asked her, she said, I felt shy telling anybody about a lump. Until it got infected with the fungus. That's when she lived after 3 years. Now, women are very upfront. They will examine the breast at the smallest lump. I've seen even ultra-Orthodox Muslim women, ultra-Orthodox Hindu women, with the parda and everything, coming and saying that there's a lump in the breast, please take it examined. That is one thing. The other thing is, of course, environmental. There seems to be an increase in cancers in general, and that would somehow be linked to the environment, to environmental pollution, because that ultimately gives rise to damaging our gene, our molecular mechanism, our chromosomes, which gives rise to autoimmunity, which ultimately gives rise to these abnormal cells developing.
As per your experience, in which age group have you seen this vitamin D deficiency leading to osteoporosis in women?
I've seen it even in young women. I've seen women like 35, 40 who are osteopenic because of vitamin D deficiency. And it's not only in women, even men get it. Because, look, let's face it, how much sunlight are you getting in this room? Hardly anything. How much time do you spend in the sunlight? Hardly anything. So your source of vitamin D has to be food. And vitamin D is only coming from non-vegetarian food. So where is the vegetarian man or woman going to get vitamin D from?
So, is there a way, if somebody starts with a cholesterol medicine, in simple words, just for the understanding of everybody. So, is it possible that it can be stopped after 1 to 3 months?
In 1 to 3 months, your cholesterol is unlikely to come down. Provided that you're very strict on your diet, provided that you say, okay, I'm absolutely on this, then in 3 to 6 months, you bring the cholesterol down, then you can stop it and perhaps maintain it at that. But when you reduce, one thing that you must understand is, cholesterol, ultimately, why are you so worried about it? Because the LDL cholesterol gets deposited in the arteries. Once it gets deposited in the arteries, if you take your anti-cholesterol medication for a prolonged period of time, it starts getting removed from the arteries. So that is the beauty. So after 3 to 4 to 5 years, cholesterol starts coming out of the arteries. So that is the beauty of it.
And what is the difference between the good and bad cholesterol?
The bad cholesterol is the non-HDL cholesterol, which gets deposited in the arteries, in what we call the endothelium, which is the lining of the artery. HDL cholesterol is the cholesterol which removes the bad cholesterol, very basically, and which removes your triglycerides, etc.
So, I think, as we discussed, the diabetes and, cholesterol, triglycerides, all are interconnected.
Everything is interconnected.
So, sometimes, a patient takes diabetic medication for a certain time, and after that, everything, when they find it normal, they discontinue it. Should it be done, or there is another way of getting the treatment continued, or what would you suggest?
When you are bringing your sugar down with medication and you have not lost substantial weight, under those circumstances, you should not stop your medication. It's very simple. Whenever my patients tell me this, I ask them only one question. If you have white hair and you use a hair dye, what will happen to your hair? It will become black. The moment your hair dye wears off, what will happen to your hair? It will turn white again. You stop your medication, your sugar is going to go up.
So people are keen to understand regarding the coffee thing. So people are asking question that whether coffee would be helpful for their liver and everything.
Well, if you have your own coffee brewing machine, it's very good.
Yeah.
Not more than 2 or 3 cups of coffee, brewed coffee, in 24 hours. You're welcome. I have a coffee brewer in my room. You can have coffee with me.
And how often should one check their blood sugar levels?
If you're a diabetic, you should check it almost every day. Otherwise, how do you know? Unless you have a CTMS,
Okay.
which is different. If you're not diabetic and you're just interested in keeping and checking it, then you should check it once a week, once in a month, perhaps every 2 months.
So it is all interconnected basically.
Yeah.
So what I got a assumption out of this discussion is that in the current lifestyle scenario, it is obviously employee they may have their responsibilities and everything. People are having the responsibilities, but if the organization also takes the ownership and they create an ecosystem for the employees along with the employees' efforts.
Absolutely.
Because intention is very important.
Absolutely.
Yeah. So I have seen people are taking medication in emergencies, acute conditions when they go to the doctor. But when they become a little bit stable, then they discontinue the treatment, or they may continue the treatment, but they
Very haphazard.
Yeah, haphazardly forget the preventive measures and everything. So I think for this thing, because it is very common nowadays in the current scenario, what how can, they overcome this type of situation? Do you have any, any type of, case studies which you have done previously, or any remedy you have suggested which have worked out?
Very difficult to say this, but one thing that you must understand is doctors make the worst patient. We as doctors neglect ourselves totally.
Yeah.
And I am an example. For example, sometimes I may take an antibiotic for 4 days and I'm feeling good. I might not finish the course. It's very wrong.
Okay.
So it's very much up to the individual how they do it. There's no easy way out of it. If you look at it holistically, that is what is important.
As we see, stress levels are increasing day by day, and I think this may also be a positive factor. Stress, I think, instigates somebody to smoke, to drink. Extended working hours are there. So as you rightly said, that they should give a stop, they should give a break to their work, and they should maintain their lifestyle and everything. And so how is the social and ergonomic environment very, significant for such employees in the organization?
So as I said, that there's a complex interaction occurring over here. So if the organization is proactive and it doesn't push the patient, the worker to the extent, that would make a big difference. In the West, there is the concept of a time off is time off, right?
Yeah.
Unfortunately, in Indians, it doesn't exist, right? Do you know that only 8% or 7% of Indians take part in leisure activities? Only 7%? It's a known statistical fact. How many people go for a break? How many people? For example, a doctor would probably be working 7 days a week. When I was abroad, Friday afternoon, if I'm off until Monday morning. I don't have to bother about any patient, nothing. Which unfortunately doesn't happen in this country. That is what is important. And if some of the organizations could enforce that in India, it would be fantastic. Unfortunately, again, if you remember some of the news articles coming out 6 to 9 months ago about working 7 days a week, which some of the doyens of industry were talking about. And in fact, something which shocked me was the person saying that why should I go home on a Sunday and just look at my wife's face? That's pretty stupid.
And I see, many employees, they are employed in cities and they are very far from their hometown. The parents are there, they are aged, and they can do nothing but, just, give a call regarding the medicine and that all these well-being. What best they can do?
So I think a health checkup is essential. Okay. A good health checkup where you get a physical examination done and where you have a set of biochemical blood investigations done and ECG, etc., goes a long way in preventive medicine. That's something which is very important.
I think, it was a great insight from in all perspectives, which I think, you have given us. All the insights shared by Sir, I think, they have been valuable for all the audience there. Thanks, sir, for your valuable time and input.
Thank you.
And this has been an insightful session for all the employees. And we look forward for further sessions as well. So thank you right now, and stay healthy, stay connected, and we'll be in touch. Thanks a lot.